Hello and welcome to our channel. If you're a farmer, rancher, or livestock owner, you understand how important it is to keep your animals healthy and disease-free. Livestock diseases can cause significant damage to both your animals and your business. But the key to minimizing these risks is early detection. The sooner you can identify symptoms of illness, the faster you can take action to prevent it from spreading. In today's video, we will explore the common signs of disease in livestock and provide you with the knowledge you need to act quickly. We'll cover a wide range of animals, including cattle, sheep, goats, pigs, and poultry, as each species has its own set of symptoms to watch for. Additionally, we'll discuss how to respond once symptoms are identified, how to prevent the disease from spreading, and the most effective treatments and management strategies available. By the end of this video, you'll have a solid understanding of what to look out for in terms of animal health and how to ensure that your livestock stays healthy. Let's dive in and make sure you're well equipped to handle disease outbreaks before they become a serious problem. General symptoms to watch for in livestock. Before we dive into specific diseases, it's important to understand the general symptoms of illness that can affect any livestock species. There are several common signs that should raise red flags when observed. These general symptoms often indicate that an animal is sick or stressed and requires immediate attention. Changes in appetite and water intake. Loss of appetite, anorexia. A sudden drop in feed intake can indicate illness or stress. Common causes of anorexia in livestock include infections, parasites, or metabolic disorders. Increased or decreased water intake. Changes in water consumption can signal dehydration or kidney issues, or in some cases, it can be linked to metabolic diseases like urea toxicity or milk fever in dairy cows. Similarly, if an animal is drinking too much, it could be a sign of diabetes or kidney disease. Behavioral changes. Lethargy. Sick animals tend to isolate themselves and avoid interaction with others. If you notice that an animal is less active than usual, it could be a sign of illness. Restlessness or agitation. Animals that are constantly moving, scratching, or showing signs of distress may be in pain, dealing with parasitic infestations, or struggling with discomfort from diseases like colic in horses or bloat in cattle. Separation from the herd. Sick animals often try to separate from healthy ones. If you notice an animal alone, it's essential to check for other signs of disease. Physical changes. Weight loss. This can occur rapidly or gradually depending on the severity of the disease. Weight loss in livestock is often linked to digestive problems, malnutrition, or chronic illness like Johne's disease in cattle or coccidiosis in poultry. Swelling or bloating. Any unusual swelling around the neck, legs, or abdomen can be a symptom of an underlying health issue. Bloat is common in ruminants, while swelling in the legs may indicate joint infections or foot rot. Changes in coat condition. A healthy coat is typically smooth and shiny. Dullness, hair loss, or skin lesions are often signs of nutritional deficiencies, parasites, or skin infections. Common livestock diseases and their symptoms. Now that we've covered general signs to watch for, let's discuss some of the most common diseases in livestock and the specific symptoms that you should be aware of. We'll break it down by species to give you the most accurate information for your animals. Cattle diseases. Bovine respiratory disease, BRD. BRD, also known as shipping fever, is one of the leading causes of death in cattle, especially in young stock. It's often triggered by stress, poor ventilation, or exposure to pathogens during transport. Symptoms: coughing or labored breathing, nasal discharge, clear or greenish, fever, higher than 103 degrees, decreased appetite and lethargy, rapid breathing or panting. What to do? Isolate the affected animal immediately and contact your veterinarian for treatment. Antibiotics and anti-inflammatory medications are typically used. Ensure proper ventilation and minimize stressors to prevent further outbreaks. Foot and mouth disease, FMD. FMD is a highly contagious viral disease that affects cattle and other cloven-hoofed animals. Symptoms: blisters on the mouth, tongue, lips, and hooves. Excessive drooling. Fever, lameness and reluctance to move. Loss of appetite. What to do? FMD is a reportable disease, so immediately contact veterinary authorities. Quarantine infected animals and ensure that biosecurity measures are followed. The disease often requires euthanasia of affected animals to control the spread. Bovine tuberculosis, TB. Bovine TB is a chronic bacterial disease that can affect cattle's lungs, lymph nodes, and other organs. It's slow progressing, which means it can go unnoticed until the disease is advanced. Symptoms: chronic cough, weight loss and poor body condition, lethargy, swelling in the neck or chest area, abscesses or enlarged lymph nodes. What to do? Testing and culling of infected animals are required to manage TB. Infected animals should be isolated immediately. Regular screening and testing should be implemented to prevent widespread infection. Poultry diseases: avian influenza, bird flu. Avian influenza is a viral infection that can spread rapidly in poultry populations. It can range from mild to highly pathogenic, with severe strains being fatal. Symptoms: sudden death in some birds, swelling of the head, neck, and eyes, respiratory distress, sneezing, coughing, decreased egg production, cyanosis, blue discoloration of combs and wattles. What to do? If you suspect avian influenza, immediately isolate the affected birds and notify veterinary authorities. An outbreak may require depopulation of affected flocks and thorough cleaning and disinfection of equipment and housing. Newcastle disease. Newcastle disease is a contagious viral infection that affects poultry and is often fatal, especially in chickens. Symptoms: loss of appetite and lethargy, swollen head and neck, respiratory distress, sudden drop in egg production, neurological symptoms, tremors, paralysis. What to do? Isolate affected birds and contact local animal health authorities. A vaccine is available for Newcastle disease, so ensure your flock is vaccinated, especially in high-risk areas. Swine diseases: swine influenza, swine flu. Swine influenza is a respiratory disease in pigs caused by an influenza virus. Like human flu, it spreads rapidly in populations under stressful conditions. Symptoms: coughing and nasal discharge, fever, difficulty breathing, loss of appetite, lethargy. What to do? Isolate sick pigs immediately. Provide supportive care, including antibiotics to treat secondary infections. Consider vaccination as part of a long-term preventive strategy. Porcine reproductive and respiratory syndrome, PRRS. PRRS is a viral disease that affects pigs' respiratory system and reproductive health. It can lead to abortion in sows and severe respiratory issues in piglets. Symptoms: high fever, coughing and rapid breathing, abortion in pregnant sows, reduced growth rates in piglets. What to do? There is no cure for PRRS, but vaccination is effective in reducing the impact. Affected animals should be isolated, and biosecurity measures must be strictly followed to prevent the spread. Small ruminants, sheep and goats. Foot rot. Foot rot is a common condition in sheep and goats, caused by bacterial infections that lead to inflammation, lameness, and pain. Symptoms: lameness or reluctance to walk, swelling and redness between the hooves, foul-smelling discharge from the hoof, lesions or sores around the feet. What to do? Isolate affected animals and trim the hooves to clean the infected area. Antibiotics may be prescribed for severe cases. Ensure that sheep and goats are kept in dry conditions to prevent further outbreaks. Caseous lymphadenitis, CL. CL is a chronic bacterial infection that affects the lymph nodes of sheep and goats, often leading to abscesses. Symptoms: abscesses or swelling, usually near the head or neck, difficulty swallowing, weight loss and poor condition. What to do? Isolate infected animals and drain abscesses carefully. In severe cases, surgical removal of the infected lymph nodes may be required. Good hygiene practices can help prevent the spread. What to do when you detect symptoms in your livestock? Now that we've covered common signs of disease and specific conditions, let's discuss the general steps you should take when you notice something wrong with your livestock. Isolate the affected animals. One of the first steps is to isolate the sick animals to prevent the potential spread of disease to healthy animals. Quarantine the animal in a clean, well-ventilated area and monitor its condition closely. Consult with a veterinarian. Always consult a qualified veterinarian for accurate diagnosis and treatment options. They can provide diagnostic testing, e.g., blood tests, fecal exams, and recommend the best course of action, including medications, vaccinations, or isolation procedures. Maintain cleanliness and hygiene. Ensure that all areas of the farm, especially the animal housing and feeding equipment, are thoroughly cleaned and disinfected. This reduces the likelihood of pathogens spreading. Follow treatment protocols. If medication or treatment is required, administer it as prescribed by the veterinarian. Follow the recommended dosage, frequency, and duration of treatment to ensure the best possible recovery. Monitor health regularly. Regularly check your animals for signs of illness, especially during periods of high risk, e.g., after transportation, during weaning, or during changes in climate. Early detection can prevent outbreaks from spreading. Protecting your livestock through early detection and management. The key to managing livestock health is early detection and quick action. By knowing the signs of disease, you can catch problems early and take steps to protect your animals before the issue becomes widespread. Always maintain a proactive approach to animal health, implement biosecurity measures, and consult with your veterinarian to keep your livestock safe. Thank you for watching. Don't forget to like, comment, and subscribe for more expert tips on animal health and disease prevention. Stay tuned for future videos where we will dive deeper into specific diseases, their management and treatment options.